Truth Show weekly podcast edition. I am your host, Dr. Caleb Slater, here with Chris, what do you do, Chris?
Stuff and things.
Our stuff and things guy, and Jill, our social media mage. I was gonna do wizard for you today,
Okay.
but I just blanked. I was gonna go with a little,
But you went with
what do you do?
pretty much nothing.
Yeah.
Yeah.
Today we're talking about carpal tunnel. I think this is a pretty interesting podcast, pretty interesting talk, because a lot of people have it and a lot of people are getting the wrong treatment. Not just the wrong treatment, but the wrong treatment to the wrong area. And, our show, we're spine focused. That's kind of the core, no pun intended, of our treatment. But this is one of those things that it is widely misdiagnosed and mismanaged in the medical field. There's a lot of conditions out there, but this is definitely at the top.
Do we know how common it is to get a diagnosis of carpal tunnel?
Looking it up.
All right, Jill's on it.
I feel like that's an interesting thing to research, one, because to me, when you say carpal tunnel, I think, well, the typical office worker is where this spawns from, right?
Well, so when I was writing my book, I was writing the hand and wrist chapter, and I was talking about carpal tunnel. So I Googled what causes carpal tunnel to see what it would say, right? And the first and main response is sitting at your desk, writing, using a computer.
And I'm guilty. I'm probably the most guilty person of the three of us here for that.
Well, the problem is that it's a little misleading. So what if you, and I think you kind of know now, but why does using a computer cause carpal tunnel? What's the typical known fact for that?
So before I met you, my understanding was the way that I was like putting my arm out and resting my wrist against something and using and it was like something along these muscles here that were causing issues. That was my understanding.
And that is what it says.
But I completely solved that by buying a little squishy thing that rests my wrist.
Right. So using a computer does cause carpal tunnel symptoms. Mm-hmm. So that is actually true. But it is not true that resting your wrist on something causes carpal tunnel. And so that's why it was so kind of widely adopted, is because it's true, but it's also false, right? And here's one thing too. Carpal tunnel is an irritation of the median nerve at the wrist, at the anatomical site of the carpal tunnel, okay? When you rest your wrist, you're not resting your wrist right here, right? Mm-hmm. And I'm pointing to like right where my wrist is. You're resting your forearm.
Correct.
Okay, that's not your carpal tunnel.
Right.
Okay. Now, they could put pressure on the median nerve, which starts at your neck. It's formed by a few segments of your neck, it travels down your arm. So you're already not getting carpal tunnel, even if you're getting carpal tunnel symptoms. If you're resting your forearm on something, that is not carpal tunnel. That could be an irritation of the median nerve, which is what's irritated at the carpal tunnel. But again, so often that's not the case either. If you think about you sitting there typing away, doing photo work, camera work, editing, right? Mm-hmm. What position are you in? Are you in a good position? Or are you kind of like leaning forward?
Yeah, I do the hunch over.
The hunch over. What do you think puts more pressure on? What do you think has more pressure on it? Your wrists resting down on something like they are right now.
Yeah.
Or your neck that your 10-pound neck that when it's forward like this becomes a 50, 60 pound weight.
Yeah. And I'm big brain, so it's like 18 pounds up there.
Which,
But no, it makes sense. But also it's funny then how you can see the correlation and possibly the misdiagnosis. And you're like, well, all these people get this. They're all doing the same thing of sitting at a computer. The pain is in their wrists where they're hunching their arms over or doing something. So it all must be from that.
Right.
But also discounting the fact that literally everyone's hunched over, like hunchbacks working.
Well, and we looked up who are the other people that get it, and it's like musicians, right? Guitarists, piano players,
you're doing
right?
The same,
and they're not resting their wrists on anything.
No.
So why are they getting it as well? But they are in that same hunched over position, right?
Yeah.
Who are the other people that we looked it up? Pregnant women. Why are they getting it? Because they can't bend anymore at their waist, so they have to bend forward at their upper back. Additionally, once they have that child, they are now nursing, carrying, they are forward for years after that, right? So, I mean, if you have 3 children, let's say you nurse for a year, and then you're holding them for the majority of, maybe the first 2 years.
It's a lot.
It's a lot of leaning forward. We get comments all the time from pregnant women saying, I got carpal tunnel when I was pregnant. No, you have a neck upper back problem from being pregnant.
Well, it's funny you say that too, because I was looking up the statistics for it, and one of the points that they have, it says pregnancy can cause carpal tunnel. Sometimes it will resolve after pregnancy, which pretty much lines up with that, because if you're not in that same position anymore after you're pregnant, it makes sense that it would go away.
Yeah, if you're able to move forward at an area of your spine that was locked, you're not compensating as much. Additionally, too, there is a cumulative effect on the nerve, a cumulative pressure effect on the nerve. So this would be something called double crush phenomenon. Basically, the nerve emerges out of, I think it's C6, C7, C8, T1, so like those nerve roots in your neck, it converge together to form the median nerve. That median nerve travels down your shoulders, splits your biceps, goes through 2 different types of muscles in your forearm, pronator quadratus, pronator teres, and then goes into the carpal tunnel. Mm-hmm. These are kind of some common sites where this nerve can become impinged, put pressure on, all right? Same thing kind of through the chest area. Let's say it emerges out of my neck and it puts, let's say 10 pounds of pressure on that nerve. And then it goes down through the biceps, and the biceps is squeezing that nerve with another 10 pounds of pressure. And then it goes to the carpal tunnel, and the carpal tunnel is squeezing with another 10 pounds of pressure. It likely took all of those, let's say it takes 30 pounds of pressure, to create symptoms.
All right, that's interesting.
It took all of those to create symptoms, but we're only viewing it at the wrist. So people will say, when I had surgery, they showed that I had compression of this nerve at the wrist. Yes, that is very, very possible, but I can almost guarantee you, and I mean almost guarantee, this isn't just a one-off, this is more often than not, by a large majority of the case, that the main pressure was actually up at your neck.
If you'd like an appointment, go to thespinaltruth.com and schedule today. We offer both in-person and telehealth appointments, and unlike the medical system, we look to the root of your problem. We look to find the cause, the why your problem, your symptoms are there in the first place, and we expect quick improvement. We expect improvement in pain, range of motion, or strength in the first visit, and 50% or more improvement in most conditions within 4 to 5 sessions. So if you're tired of being in pain, if you're tired of the medical system and its approach failing you, and you want something different, go to thespinaltruth.com and schedule today. Now let's get back to the show.
So my question was going to be, on your carpal tunnel journey, before the symptoms of carpal tunnel at your wrist reveal themselves, what other symptoms reveal themselves earlier that you kind of discount?
Sorry, very good question. Let's say you have carpal tunnel. If you have carpal tunnel, true carpal tunnel, you only have symptoms in your wrist and hand. You only have symptoms in your thumb, your index, your middle finger, and then the lateral half of your ring finger. Okay? That's it. You have pain, numbness, tingling, or weakness in that part of your hand. You do not have symptoms anywhere else. Okay? But so many people out there have symptoms in their forearm. They have elbow pain. They have shoulder pain. They have history of neck pain. Or they have symptoms on their pinky. Okay? Which can't be carpal tunnel, but these people are getting diagnosed with carpal tunnel. They're going to their doctor, their primary, their orthopedist, their hand specialist are missing these very easy to pick up cues that it's not carpal tunnel. And they're getting diagnosed with carpal tunnel, and then they're getting treatment where? At the wrist, at the hand. That treatment isn't working, and then they're told they need surgery.
So I have a quick question based off of that, because when I'm looking at these statistics, it says carpal tunnel surgery has a success rate of over 90%. So what do you think they're essentially fixing to make people's hands not hurt anymore if it's still an issue from their neck?
Yeah, I mean, when you look up the surgery statistics, I feel like they're all a little misleading. Like, how do you categorize success? But we talked, it can have a cumulative of pressure on that nerve. So if I do relieve some pressure, I can relieve those symptoms, even if it's not the main cause. And additionally, you can relieve pressure at the neck without surgery, without injections, without medication, right? And it's very likely the actual main driver of this problem. And a lot of those people that get carpal tunnel, their symptoms come back.
Yeah, that was going to be my question. How much of a temporary fix is the surgery?
I see people with symptoms return and or symptoms on the other side within probably a year.
Wow. So if you have the symptoms of carpal tunnel and you have legitimate carpal tunnel, is it something that is all the time, or is it only when you're doing certain activities?
It's most of the time. It'll be more when your hand's in a certain position, wrist kind of a little curled, but it'll be pretty much all the time. It'll be pretty consistent. The tunnel has closed down. It is almost consistently putting pressure on that nerve. That nerve is chronically irritated, so once that nerve becomes irritated, it becomes easier to piss that nerve off.
Okay.
Less amount of force, less amount of stress, less amount of pressure is needed to create symptoms. So it becomes pretty consistent, pretty constant.
Now, what about if it's coming from your neck?
It can be consistent, but it's typically more variable, and that's kind of the way discs present. They have a variability presentation. Sometimes it's there, sometimes it's not. Sometimes, like if you're laying down on your back flat, you might be okay. You put 2 pillows, all of a sudden you get your carpal tunnel. You just got into your car, you've been driving for 20 minutes, you're okay, but now another 20 minutes of sitting in that position, now you're getting your carpal tunnel.
Okay.
Also, too, if it's coming from your neck, you're very likely to get symptoms on both sides. So that is a very specific presentation of cervical spine neck issue, right? If you have it on both sides, you're almost guaranteed that you have a problem at your neck, not carpal tunnel. So if you're out there and you have bilateral carpal tunnel, you have a neck problem. You don't have carpal tunnel.
So what about the typical treatments that they do for carpal tunnel?
All right.
What does that look like?
Do you know any?
I know the cock-up splint thing. Okay. My friend used to have to use it all the time.
Yeah.
And I was like...
Not a big fan of those because they actually put pressure on the volar aspect of the wrist, so like on the front part of the wrist.
It kind of forces your
hand up. Yeah. So again, they don't want your wrist to flex, which what that does is that causes the nerve to push into a ligament here.
Okay.
So you can kind of picture, I don't know, like a guitar string getting pushed forward. That's not a good description.
But even looking at it, it's like, is this supposed to be a permanent?
Well, and what happens too is in order to cock your wrist up like this, there has to be some pressure right here, right?
Yeah.
What isn't the cause of carpal tunnel, if you look it up, from pressure on on that part of your wrist?
Yeah.
So why is then putting your wrist in this position and putting pressure right there a solution to it? And most people won't wear them. Most people, they'll need them kind of at night, but again, it's a cumulative pressure issue. You're putting pressure on your neck at night. If you sleep on your sides, your neck is flexed. If you sleep on your back, your neck is flexed. Even if you sleep with minimal to no pillow, your neck is still flexed, right? Almost nothing you do throughout the day do you really look up. When's the last time you looked up like that, Chris?
Last time I dreamed about the future.
Right?
And I gave up on that a long time ago. No, seriously though. Like, unless I just want some temporary feeling of relief, I'm not naturally just looking up at things like that.
But you kind of said it right there, right? Like temporary feeling of relief. You'll be at the computer and you'll probably be like,
yeah, exactly.
That like feels and hurts so good, you know? But doing more of that will actually fix the problem for most people.
Yeah, because you're just kind of reversing the position you've been in.
Right, and it's kind of that simple, right? We've made medicine and a lot of these physical treatments so much more complicated. So we got back to the treatment, right?
Yeah.
The treatment would be probably an injection, maybe some medication. They might put you on a nerve medication, which again, both of those just numb you to your symptoms, just mask your symptoms. The problem's still there.
Yeah, so let's talk about that those medicines for this. Is that supposed to be a permanent thing when they give that to you? Like a permanent solution?
If anybody were to sell it to you as a treatment, they're wrong. They're lying. They're either lying to you and or to themselves, or they're incompetent. It's not a treatment.
It's temporary.
It's temporary.
Yeah.
Right. The other then they'll send you to maybe a physical therapist, maybe a OT or a hand specialist, right?
Yep.
They will do silly little stretches at your wrists that don't work, your wrist and forearm. They will do maybe some tendon gliding, some nerve gliding. also won't work. They'll do some massage at the wrist and forearm. And again, if it's carpal tunnel, why are you working on the forearm? They'll work on maybe your posture. If it's carpal tunnel, why are they working on your posture?
Well, if your posture is better, would that not affect your neck?
No, it would, but if it's true carpal tunnel, it wouldn't change anything.
Copy.
So
It's like they don't believe it's actually...
Right, they don't believe it's actually carpal tunnel. So
Right.
like they're kind of doing the right thing,
Yeah.
but they're not doing enough of the right thing.
Gotcha.
Right? So, and they're working on, when they work on your posture, they work on stretching your pecs, right? So stretching your chest out. That's just temporary too. If I stretch out my chest, that's great. You know, now maybe I've created a little bit more flexibility, space in that range. But if I've done nothing to strengthen in that range, then when I go back, when I drive home, by the time I've gotten home,
It's going to be back to...
I'm right back to where I was. So it's just temporary relief as well. They'll do some ultrasound, some laser, maybe some shockwave therapy, some trigger points, some stuff like that. None of that really works. And then after it hasn't worked, then you're off for surgery.
And then once you have the surgery, what does that do for you? What does that impact your life?
It's actually not too bad.
Okay.
The recovery isn't too bad. Within a few weeks, you're pretty much right back to where, like, you know, living your normal life for the most part.
What is the surgery that they do? Like, what are they
They
trying to fix?
rebuild that space. So the space has collapsed. They rebuild that space in your wrist to take pressure off the nerve. They decompress the median nerve at your wrist.
Okay, so you have the surgery. Maybe it works for a year, but then the pain comes back. Do they do the surgery again?
Yes.
So it's just to keep repeating the
They'll
surgery.
probably do it again. And how about this too? So for the people out there listening to this, if you've had wrist, hand pain symptoms and you've been told you have carpal tunnel, have you had your neck looked at? Has somebody looked at your spine? Has somebody said, hey, it could be your spine, so before we go forward with this, let's take a look at your neck before we start treating your wrist, before we start treating an area that might not even be involved. And unfortunately, I think it's going to be few and far between the people that reach out and say, yeah, the doctor also looked at my neck.
And particularly, you mentioned the bones, but where exactly would you describe that part of your neck? Like above your shoulder blade?
So right above that, it's a little bit below that hump area.
Okay.
And a little bit above that hump area. So it's your lower neck for the most part.
Would you have pain or soreness in that part of your neck?
It's a good question. So you might have at one point. You know, you might have, years ago in college, you're studying and you had some neck pain and then you just kind of forgot about it.
Yeah.
Over time, that neck pain that you didn't really fix, you didn't address, and you just kept doing more of the same thing, more of sitting, more of computer work, more of reading, more of being on your phone, right? You kept doing more of the same thing. You didn't actually address the problem. Now that problem begins to progress, begins to morph, change. So now most of these people, they'll end up going with some bit of shoulder pain or elbow pain. They don't realize that it was actually the same problem, so they get their shoulder or their elbow treated. Shoulder or elbow pain kind of goes away over time. Maybe the treatment helped, quote unquote, right? Or they took some medication, they got used to this symptom, they got used to this, became their new normal,
Well,
they kind of got used to it.
Yeah, if it's dull enough, I would just ignore it. And then at some point, I ignore it so much that it just becomes not even noticeable.
It just becomes the way you are.
Yeah.
Right? And this is the way it is for most people. And then all of a sudden it turns into their hand. Now your hand's a little bit more noticeable, right? Like it's easier. Your hand has more mechanoreceptors, so like you actually feel more with your hand. Okay, so your hand is more sensitive. You use your hand kind of more and more meticulously, more fine-tuned. So a problem in that area can cause a problem more in your life. So now you go and you get this addressed. So for a lot of people that have these symptoms, they don't currently have a neck problem, or they're like, yeah, that neck problem, that's old. That was there a while ago.
Okay. So let's go down this path. Let me ask you this. Say you go that you have carpal tunnel, diagnosed with carpal tunnel, you get the surgery, you still haven't fixed the root cause of the problem. What happens next? Does that neck impingement cause further problems as well?
Further problems in the hand?
Like, is it as far as it can go? Is the carpal tunnel symptoms, or can it keep going somewhere else?
Well, when a nerve continues to be damaged and continues to be in the process of getting more and more damaged, it'll go from pain to tingling to numb to weak. Weak is the worst. Weak is that nerve is basically the signal's not getting there. You're not able to even use that signal to contract that area.
So you might start losing some sensation in your hand.
You'll lose some. A lot of people have lost grip strength.
Gotcha.
But you'll lose sensation. Your whole hand will be numb, and then your whole hand will be like hard to operate. You ever get your hand like really cold outside, and like it's hard to make a fist? When you come in, it's hard to untie your shoes.
Yeah.
Kind of similar to that.
Now, okay, so what does the proper treatment look like?
Treatment at your neck.
Treatment at your neck.
Treatment at your neck. And you kind of alluded to it earlier, right? Like, this is pretty simple. We've made this too difficult. If leaning forward and poking your head out is the problem, leaning backwards and retracting your chin and extending your neck is the treatment. And so for the people at home that want something, and maybe even want proof, right? They want to see this in action. You can go to our TikTok page, and you can click on the Carpal Tunnel playlist. We'll talk you through a lot of this, but at the end of the list, we show you 2 to 3 exercises that you can do to actually take pressure off this nerve, and if so, prove to you that your symptoms were actually coming from your neck.
So how long will you have to do these exercises before you start to see a change?
I expect to see a change on the first visit when somebody comes in. So let's say they come in with any one of pain, numbness, tingling, weakness, right? Number one, you have to map out the symptoms. You have to, I'll use a dynamometer that, you can go, it'll say 66 pounds or 100 pounds, right? So we'll be able to see the difference from when they came in to...
Can you tell me what a dynamometer is?
Grip strength.
So they literally grip and then you can get a
they
number
grip
from
and it gives you a digital readout.
Copy. Okay.
Right. I'll have them put their hands and wrists in certain positions to try to provoke the pain, right? I'll have them do any type of activity. Some people might be like when they're doing a certain yoga pose and they're on their hand. Everybody has a little bit different something, but you have to map it out, right? You want to map it out, what it is, where it is, how much it is it a 7 out of 10? Is it numbness, tingling, pain? What is it? Then treat the neck. After you're done treating the neck, then go back and see if those symptoms in those ranges have changed.
So tangentially related, maybe not even at all. So I'll do like yoga with my girlfriend and stuff. She is very much more flexible than me, but like I can't pull my wrist back very far. Those muscles seem to be tight or whatever's going on there. Could that be from my neck, or could that just be from not stretching it? Or?
No, it can. That area of your neck innervates those muscles,
okay.
Right? If those muscles aren't innervated, they lack the ability to behave properly.
Okay.
Muscles need to contract. Muscles typically don't like to stretch. And if you see so much treatment out there is geared on stretching. Stretch your hip flexor, stretch your neck, stretch your pec, stretch your quad. Muscles actually heal by contracting. The best way to strengthen, remodel, and promote flexibility is to contract your muscles and range muscle contraction to fatigue. So in their most shortened range, through their full range, into their most shortened range, a good strong contraction to fatigue that promotes muscle contraction, blood flow, nutrient exchange, healing. Our body heals by blood flow. So if that nerve signal isn't getting to those muscles aren't being as active, they'll start to die, right? A muscle, when it dies, it starts to calcify. It starts to become more rigid. If you picture like an old rubber band that has like little cracks in it, and when you stretch it, it doesn't really stretch back when you let go.
The way you always describe it to me, I picture like a vampire who's been sleeping for 500 years, but when you give him the blood, things start to, you know what I mean?
That's an interesting way to picture it.
That's how I see it in my head. But when you say your muscle dies, does that mean it can't be worked on and healed and repaired?
The cool thing is that you can actually heal. So when I say the muscle dies, I'm being a little hyperbolic here, but it calcifies, it actually thickens, it has less blood flow to the area, and it'll change its chemical makeup a little bit. It forms little blood bundles called neovascularization. They little blood bundles that will cause pain when your muscle ends up contracting. The cool thing is that you can remodel this. You can actually completely reverse it. It takes a little bit of time and you have to know what to do, but if you get a good strong muscle contraction through that area, you progressively load it, you progressively work it through its full range, you will break up the calcifications, you will bring blood flow to the area, you'll break up those neovascularizations, and now your tissue will turn into a new rubber band.
If you're out there and you're in pain, if you're tired of the current medical system, failing you over and over and over again, just giving you answers that numb you, pacify you to your symptoms, and are largely based on medication, injections, and surgery, and you want a different way, maybe even a better way. Look for my book, The Spinal Truth, A New World of Medicine. In it, each chapter I talk about a different symptom, different condition, different body part, and how I view it a little bit differently than the current medical system, and how my treatment has helped so many people out there when they've been let down with the typical approach. This is the way I think medicine should be. This is the change in healthcare I think we deserve. So thespinaltruth.com, you can look for my book on Amazon, Kindle, Apple, and on audio.
Okay, so your treatment options for carpal tunnel are you can go and you can get pills and you can get injections and eventually surgery, and all those potentially could lead to some temporary relief. Or you could just take a look at your neck and try some exercises and possibly get much better relief, if not cure.
To the underlying cause.
The underlying cause.
Which at the end of the day, your neck will also be better too.
Yeah.
You know, you have more mobility. The neck pain causes a lot of symptoms. It'll cause shoulder pain, facial pain, jaw pain, headaches, migraines. Like
right.
you'll get a lot of these, maybe some dizziness. These are all common comorbidities with neck pain.
And if you are going down the carpal tunnel journey, that's going to take months to year to see all those specialists and eventually go through all that process. But in that time, you could do some exercises with your neck and possibly see
right away
much better results.
And why not try that first,
yeah, exactly.
Right? Why not try that first? Give it 2-3 weeks. Give it 2-3 weeks of addressing your neck. Because I expect to see changes on the first visit, but those are just changes. In order to get yourself to where you are now better and to stay better, that takes a few weeks. But during that time, you're seeing pretty consistent improvements. And honestly, carpal tunnel symptoms, it's pretty easy to treat, because if you apply the right treatment to the right area, you get pretty quick and significant results. So if you're not getting that, how about that too? So I completely agree, and it's my whole point. Why not get your neck properly assessed and treated first? And if you don't want to come to me, McKenzie therapists do a pretty good job. You can look them up, McKenzieUSA.org. You can look up and see if you can find a local provider. They have a pretty similar mindset to this for these symptoms, for carpal tunnel symptoms. You can go onto our TikTok page and you can just see some of the exercises that we would do for these symptoms. Why not do that first? Because if it doesn't work, you still have all that usual option, right?
Yeah.
Would you also say too, I know a lot of people are going to comment and ask if their chiropractor can work on an area of their neck, but we've talked about how that's usually a pretty...
It's temporary.
Temporary.
Yeah. So, I mean, like, I can crack your neck. I will do that with patients at times, but I explain to them that it only creates some movement, it only decreases some pain for a temporary time. If you don't do anything to maintain that motion gained, if you don't do anything to strengthen in that area, you will not stay better.
I know that's going to be in the comments, that's why.
Yeah.
You're just preemptively addressing it.
Were you able to find the number?
So it does say, from multiple reports, it says the general population ranges from 1% to 5% people have carpal tunnel syndrome. The one thing I did find interesting too is that it's also reporting that it's a 3-to-1 female to male ratio. So women are 3 times as likely to get carpal tunnel, which that mainly I would assume is from pregnancy and things like that.
Pregnancy, and then in general, a lot of times women have a little bit worse upper back just because they're a little bit more weighted differently.
Yeah.
Oh, that's a good point. I didn't even think of that. Yeah. I just was thinking mainly for, pregnancy, and then if they're breastfeeding or something, you're hunched over all the time.
You know what else too? Besides, and when we say weighted differently, we're talking about, how would you phrase that?
Chest.
Chest. All right.
Well, that, and I think your center of gravity is different, sure. Right? Like women and men's, their center of gravity is a little bit different.
Well, you know what else is actually probably, and maybe even more of a cause, and a lot of people won't realize this, what causes your carpal tunnel if you're a female? What do you think?
High heels.
No.
Nope.
All right, I'm going to give you a clue. I think Jill's doing it right now. And it's worse if you're in a car.
Oh.
I don't know.
Is it like the way you sit, like your back is?
Your hair.
Oh, my hair.
I can't tell if you're in a ponytail right now.
I have a bun.
Oh, yeah, there you go, a little bun. Yeah. So it's something you would never think of, Chris, right?
Right.
But if you have a ponytail or a bun back here,
Yeah.
you're not resting against.
Oh,
so
yeah, you
true.
can't.
Sure. You get a lot of women that say my symptoms are worse when I'm driving, and I'll say, well, next time you're in the car, move your bun, move your ponytail, and then it's a lot better. And it's actually because they can't put their head back against stuff. So, and again, this is cumulative over time.
Yeah.
Over time, where me and you are sitting back, resting our head, and let's just say Jill is an inch forward. Over time, that inch becomes a difference.
Wait, I've noticed that because sometimes if I'm watching TV, like the way our couch is, I'll lay kind of like with my head here and then I'm laying down. But if I'm laying on a pillow, I have to kind of put my bun like over the top of the pillow. Otherwise, it's just like jammed into my head, but it does put my neck in a weird way. Yeah. And I notice like if I'm on my phone, I'm like, this kind of hurts my hands after a little bit, so I have to move.
So I think that's something that a lot of people out there didn't realize. So your carpal tunnel symptoms are coming from your hair.
Your hair, your neck, yeah. If we just normalize a sit like this all the time.
Well, and you don't have to. You just have to move into certain. You just have to undo that position once in a while, right? This isn't complicated. It's pretty simple. If you're doing this all the time, once in a while, do the opposite.
Yep.
I mean, it can't be easier than that. And people are going to say, well, my doctor diagnosed me with carpal tunnel. Like, well, your doctor got it wrong. Your doctor, if they didn't look at your neck, they're wrong. If you have symptoms in your pinky, they're 100% wrong. If you have symptoms in your forearm, they're wrong. If you also have elbow pain, they're wrong. If they didn't look at your neck, they're wrong. Your doctor got it wrong. They did you a disservice.
Yeah. But hey, keep your appointment. That's 2 months from now. But until your appointment, try doing those exercises, and maybe you'll be able to cancel that appointment.
Yeah. At least show that it was coming from that area, and then you can seek the right treatment to the right area.
100%. Yep.
All right, well, that's our show for this week. Hopefully we answered your questions about carpal tunnel. If you have any questions, though, leave a comment down below. You can reach out to us also on TikTok, Instagram, Facebook, and YouTube. Next week, we are going to interview somebody who had asthma, somebody who was diagnosed with asthma, getting treatments for asthma, treatments that weren't working, and then eventually saw me and fixing their spine, addressing their spine, cured their asthma symptoms. So that'll be an interesting interview. Stay tuned next week for that.